Well, there is one thing many of us living here in the Valley of the Sun need to know about is skin cancer. How to prevent it, how to treat it, if you have it. I want you to meet Dr. Lauren Stegman. He is a Palo Verde Cancer Specialist with how their treatment might be the right choice from you. And Dr. Stegman, I am fascinated about what you do. I mean, skin cancer is very prevalent here. Explain to us very quickly, though, there is a difference between melanoma and non-melanoma skin cancer.
Right, yes. So there's two main types of skin cancer, as you said, melanoma and non-melanoma.
Okay.
Non-melanoma consists mostly of two types, squamous cell carcinomas and basal cell carcinomas. Those kinds of cancers tend not to spread as much. They're more squatters than spreaders. They kind of start in a place and can grow there, but they don't nearly as often as melanoma spread around the body.
Okay.
And they're much more common even than melanoma too.
And that's the type of cancers that you treat are the non-melanoma skin cancers?
Mostly, yes.
Okay.
So usually for non-melanoma skin cancers, the treatments are either surgery or radiation.
Okay.
Melanoma, occasionally radiation can be helpful, but it's usually surgery is more important.
Okay, so here's what I want you all to think about, that if you've been diagnosed with non-melanoma skin cancer and your doctor says, you know what, we need to remove that, chances are you're dealing sometimes with some scarring, sometimes some delicate areas. The option that you're giving us is that you treat it with radiation, and therefore no surgery, no scarring?
Right, so they usually will do a biopsy first to make sure we know exactly what it is, and then the radiation treatment replaces the surgery, a Mohs surgery or what's called a wide excision, and those surgeries, you know, sometimes will require reconstruction procedures and skin grafts and things like that.
Yeah, you were telling me that if you were diagnosed with it maybe on sensitive areas like your upper lip or around your eye area, you know, surgery can be very invasive and leave some scars.
Yeah, or it can affect function, you know, from scarring that makes the lip tight or the eyelid change or things like that. So radiation's been used for over 100 years to treat skin cancers and works as well as surgery in most circumstances for those things. So it's best on areas on the face, the eyelids, the ears, the nose, the lips, and on areas of the body that don't have good blood flow or that are prone to getting injured, where it might be harder to heal after surgery, like the shins or the sides of your arms.
And you said it could also be good for people who maybe are diabetic and have certain other issues that would cause healing, you know, to be more difficult. So is there a scar with this type of treatment?
So usually not. Most of the time when we give the treatments, they can be between anywhere from 8 to 10 treatments, some places in the body, and some we have to treat longer than that. But it's a 10-minute visit. You come in, put the device, which looks like a little metal circle, right over the area. The radiation only penetrates the depth of the skin and just treats right around the tumor area. And most people don't have any issues during the course of the treatment, but right afterwards you get like a sunburn in the area and the tumor kind of peels off and goes away. And then afterwards it heals and it can be tanned for a few weeks to months or so afterwards, and then it might be a little bit lighter color, and then within a few months, usually it turns to, you can't even see anything there anymore.
That is really amazing. Is this type of treatment covered by insurance?
Absolutely, yeah. Medicare, private payers, they all will cover this types of treatment.
And the number of treatments, I'm assuming, depends on the individual and the type of non-melanoma treatment that you're doing.
Depends on the size of the tumor, where it is, individual preferences, and those are the kinds of things we talk about as to what we think is the best regimen that's going to be the best for an individual.
Excellent. Well, you're going to stick around, right? Because we are going to do another segment. Actually, Dr. Stegman brought along a patient. You're going to meet Jackie, and she's going to tell us about her treatments and the success that she had. It's very, very interesting. Let me give you some information. Palo Verde Cancer Specialists, they're located at 7373 North Scottsdale Road. That's Suite E100 in Scottsdale. You need more information, you can call them at 480-941-1211, and you can always learn more at PV, it's HOMED.com.